Good morning, my dears. My face feels so ashy right now. I'm actually kind of late. It's 7:38 because I was sitting down, chilling, watching Love and Hip Hop Atlanta. I mean, just kidding. Watching Love and Hip Hop Hollywood, the reunion and stuff. And I was like, I'm gonna leave the house a little. Everybody got their lights on. Should I have my lights on? It's not that dark outside though. But anyways, I was watching Love and Hip Hop Hollywood reunion part 2, and I was like, oh, I can leave the house a little late today because I don't have a test, you know. So then I get up, my hands feel mad ashy, but then I get up, you know, go to the kitchen, get my snacks ready, and what happens? My chips fall on the floor. So I'm like, oh, great. When the day that you want to kind of leave a little late is the day that something happens and you leave more late than you planned. I'm not that late. It's only 7:39. My school is probably 15 minutes away, if that. I gotta time it one day. I think it's about 15 minutes. But it's no highway or anything. It's just the streets. So it takes a little longer because of lights and stuff. But I will get there on time. I'm just mad that I left this late. But yeah, it is Tuesday, November 15th already. In 2 weeks is Thanksgiving, y'all. 2 weeks. I can't wait. And also, after I come back from Thanksgiving break, I start clinicals. We're only doing 3 or 4 for this semester, but it's still clinicals, so that's fun. I have an exam on Thursday, a mental health exam, so I started studying for that yesterday. I did 2 chapters. The 2 biggest chapters I did yesterday, and the 2 littlest chapters I'm doing today. And then tomorrow I'm going to review everything that I've learned, and that's about it. This weekend was amazing, you guys. Oh my gosh, thanks to all the veterans and all the people who, you know, went out and served for us on Friday. But this weekend was the best because I had a 3-day weekend. I was on Friday, Saturday, Sunday, including Monday, so 4 days, but Monday I take to study, so I don't count that. But I watched 4 movies this weekend. I watched Now You See Me 2. That's a good one. I watched Bad Moms. That was hilarious. I could watch that again. I watched The Thinning. That was really good. And I also watched my all-time favorite. I actually cried. If you follow me on Snapchat, I was crying because that movie was so touching. It was so good. The person who wrote it, directed it, everything was perfect. The music, everything. It's called Me Before You. It's really old. I mean, it came out this year, but it came out like a long time ago, so I just now seen it. But it was so good, like so good. Yeah, it was really good. I liked it. I could probably watch that again too. I was rewinding parts because I'm like, oh my god, it's so good. But yeah, but I'm on my way to school and I'm going to listen to music and drive so it can kind of make me go faster because I am stuck in traffic, which sucks even more because it's 7:42 and class starts at 8, so that's not good. And so I'm gonna try to hopefully get there on time, and I will see you guys after class. Bye-bye. Hello, my babies. Just got from class. It's 12:20 about. We got out like 11:50 like normal, but I stayed to look over my exam that we took last week, the one that I got 78 on. I stayed to because I like to look at the rationales and see why I got it wrong and stuff like that. And I got the stupidest stuff wrong, and some of them I got them right and I changed my answers. So I think I'm gonna officially make a pact or something like that to stop changing my damn answers, because sometimes I change them to the right one, sometimes I change to the wrong one, but it just annoys me when I change my answers, so, and I get it wrong. But yeah, so I'm on my way home. I'm extremely exhausted. I just want to take a nap. I'm going to finish studying for my mental health exam today. 24 and 25 aren't that long. So I'm going to finish, and one of them is personality disorder, so that's interesting. So I'm going to finish studying for that today, and then review tomorrow. Tomorrow we have lab. Our usual lab instructor isn't here, so we have other people teaching us. So and we also have a math quiz tomorrow. Normally we have them Friday, but since we didn't have school last Friday, we have 2 this week. We didn't have a math quiz last Wednesday or Friday. We didn't have class both days because Wednesday people went to go get flu shots, and then Friday was Veterans Day, so we didn't have it either day. So we're making it up this week with 2. And then after school tomorrow, I'm going to, you know, relax and then review everything for mental health. Hello, my dears. On my way to class. Actually, I'm probably gonna go to McDonald's before I go to school. My nose is hurting. That means I need to wash my hair. But I just washed my hair like 3 days ago. Saturday, I think. Or Friday. So I'm confused of why my nose is bothering me. But anyways, yeah, I'm on my way to class. We are learning nasogastric NG tubes and stuff like that. So I don't know what we're doing with them. I don't know if we're learning how to clean them or whatever we're doing, but that's what we're doing today. Let's make it stop. I don't know what I was gonna tell you guys. Oh, we're moving. I told you guys that. I probably did, but we are moving in December. I'm not gonna tell you guys the date, but we are moving in December. I'm probably gonna film the move because we have movers coming to do it for us. Usually we move ourselves, and I break my back to move because I carry all the heavy stuff. Me, my dad, me, my uncle, like we carry. And that was when we were in Florida too. We had like all the boys that were in our youth to help. Now we're here. I don't know if you guys can even hear me. We don't have anybody to really help, and we already moved like 2 times. Like moved my uncle and my aunt like 2 times. Or 1 time, so, and we'll move one of my other uncles another time. So I'm used to carrying heavy stuff. I don't mind it, but I'd rather not sweat. I'd rather be like, oh, put this here, you know, put this here. So I'm so happy. Me and my mom are like, yes, we don't have to do anything. All we gotta do is be like, okay, yep, put this up, put this in the truck. And they have their own truck, everything. They charge $150 per hour, which is not bad. They shouldn't take more than 2 hours to do it. So we don't have to do anything. We just gotta say like, oh, pick this up here, put this here, put this here, put this here. We don't have to actually like do anything. I don't have to sweat the first time I'm moving something in. I don't know how long that I don't have to sweat. It's gonna be amazing. I'm gonna start packing probably beginning of December because I have, as you guys know, I have like stuff on the walls. I have, what do I have? That's it. I have stuff on the walls. I gotta finish painting all the stuff that's yellow. I gotta paint that blue. I have so much crap to do before we actually move because I don't want to put paint on the new carpet, if you hear what I'm saying. But yeah, so we have all that stuff. I'm excited. New chapter in our life. We get to move. We get to start off fresh. So that'd be fun. A little closer to my school, far away from my job, but I don't really mind because I don't work every day. I only work every other weekend. For my mom, it's a little bit harder because she works, you know, normally, so it's a little bit farther too. But we figured it out. We took the route to see how far it takes. It's actually across this road. But yeah, I'm going to school. I'm gonna go to McDonald's first, and I will see you guys later. Bye. It's focus period. But hello, my babies. Just got from lab. I stayed extra a little bit to practice the NG tube because your girl didn't know what the freak was going on. Because I'm not a CNA, so I rarely see NG tubes. I rarely know what is going on, so I stayed a little longer. One girl who gives meds, she was like helping me understand. And then I went to Little Caesars to get some pizza. I got a 9 out of 10 on my math quiz, like an idiot. I'm pissed off. I got the stupidest one wrong. I just, you know, could turn the car with one hand. I multiplied something wrong, but it's fine. I still got a 90, which sucks because that brings you right to like a B, which is crazy. But yeah, I got a B on it, whatever. But the one on Friday, I'm gonna get a great grade. I'm gonna get 100 on it. I can feel it, because I'm not gonna make the same stupid mistake again. But yeah, I'm home. My mom's not home. Don't know where she is. She gets up at 2:30. I don't know why she's not here. It's 3:48 or 3:43. But anyways, I'm home. So I'm gonna go eat this pizza and I'm gonna study for my mental health exam tomorrow. Fun. And that's it. So I'll see you guys tomorrow morning, bright and early. Bye. I'm gonna enjoy this pizza. Yes. And it's fresh. I can smell it. So I'm gonna go eat it now. So bye. Back to the light. It's so crazy. Like, it's supposed to snow today. Yes, it's supposed to snow November like 17th or something like that. It's crazy, but to me it's crazy, but to everybody else it's normal. I feel like it should start snowing in December. But hey, on my way to school. It's 7:28. As you guys know, when I have a test, I leave a little early, just so I can talk to the people that get there early, so I can see, like, you know, pick their brain a little to so maybe something I didn't know that they might tell me or something. What I was gonna say, yes, it is Thursday. I work this weekend, unfortunately. I hate it. I hate working. But yeah, my stomach hurts. It's that time of the month, so I'm just basically just tired. And I took a leave, but I didn't kick in yet. But the thing with me and medication is, I have to. Come on now. I have to take it and go to sleep. I swear I hate here. I can't wait to move from here. These people drive weird. They do not know how to drive. I'm taking this slide. Sorry, sir. That car behind me thought I was gonna take it. Anyways, like I was saying, my stomach hurts, so I just hope I can focus for this test. I don't know if you guys can even see me at my focus, but we have this lady coming today at 11:50 after class to talk to us about the BSM program, if we would like to move on, like what classes, I guess, and some information. So I'm gonna stay and hear her out, because I probably want to do it because I don't plan on living here, and I don't know if they'll accept 2-year RN anywhere else, kind of. So I'm just gonna see what my options are and see what she says. But if it's too much, then I'm just not gonna do it. I'll just work for like a couple years and then go back to school and get it. Hello, my loves. My lips are probably a little chapped.
Give you money on home and rent.
Stayed at school, just got out of school just now.
Savings into your
it's like 1:30 something, because the lady that was from Mayville, like a different college, she came to speak to us about the RN to BSM program. Y'all, it's like so cold. It's supposed to snow today, so whew, it's freezing. But she came to talk to us about the RN to BSM program, and we can get it, our BSN, in a year. Like, who would not? Like, I think I'm just gonna do it. I'm not even hesitating. I know I'm gonna do it. I need to get my grades more up. As you guys know, I had a test today. I did fail. I mean, I don't have any. I don't even have tears in my body. I didn't even cry today. I have nothing to say. I don't even know what to say, but I did fail. I got the starting rate for a D. So yeah, I thought I was gonna pass. That test was really hard though. A lot of people said it was. Yeah, and she's really strict. She doesn't really give back points, and even if she did give back points, I would probably not pass still. But yeah, I mean, you win some, you lose some. But the lady that came from Mayville, the other college, she just like kind of like motivated me to do better. Like, she was just talking about her college, like, I can't wait to move on, and it's only a year, and you do one class every 5 weeks. So it is sped up. It is pretty, you know, fast. It is pretty quick, but I mean, you can get it in a year. Like, why not? What else am I gonna say? I failed my test. Failed, but I don't even know, like, I have no strength right now to even think about it. And then I have a test Tuesday coming up that's on 8 chapters, so I just gotta keep it pushing, keep it moving. Like I said, guys, you pass some, you fail some. Last week I got an A. This week I got a D, so whatever. I probably won't, I don't know yet, but I know for sure I'm gonna apply to that one. And within that same year, so within my RN year, I would have to apply by March 1st. So having 2 references, having all that stuff. So not too bad, but I'll let you guys know more when it gets closer. I'm not even done with my first year of LPN, so you know, but I will let you guys know what I'm gonna do when it gets closer. Of course I'm gonna do it, but I'm gonna let you guys see my application process and all that kind of juicy stuff. But I am almost home, so I will see you guys tomorrow morning when I go to lab at 12:30. Bye. Hello, my babies. I like got a scarf, jacket. It's cold, sweater, boots. It's 41 degrees. It's supposed to drop all the way to 15, I think, today. That's why my lips are glossing. It's Vaseline, but you know, so I don't get chapped. But y'all, it's cold. I got the heat on. I don't feel like it's on full blast or anything, but I mean, the sun is out, but it's cold. But I'm on my way to class. I'm a little late. And when I say late, I don't mean late, like really late. I just mean I usually leave, you guys know, I usually leave like my house at like 11 or something and get there and just wait. Study math and stuff. But but it's 11:48. So class starts at 12:30, so I'm gonna get there right at like 12:15. It's 11:48, yeah. So, I mean, but I was eating, I was watching some YouTube videos to catch up on, because I'm so behind on life. But yeah, I need to get a mount so I don't hold my camera and people think I'm crazy now. But anyways, yeah, so I'm on my way. I forgot, damn, like I had my freaking seatbelt on because I got so much clothes on. But yeah, we have another math quiz today, and we get our clinical, you guys, we get our clinical like worksheet, like to know who we're gonna be partnered with and stuff like that. So yeah, I'm excited. I would let you guys know the schedule when I get home, like when I get off. But wish me luck for my quiz. And there you go.
You never have to worry about sticking a penny in.
Hello, my babies. Hello, my baby. And stuff. But just got out of class. It's 3:22. Well, I'm almost home, so I didn't just get out. But you get what I'm saying. It was actually a fun day today. We got I'll show you all the stuff that we got when I get in the house. But yeah, we got all that stuff. We got our partners, we got our times, we got our like examples of the care plans and paperwork. We got, that's it. But we did get to do assessments of like lung sounds and heart sounds, which was cool. They had this like machine that had a speaker, and like you press buttons, like the person can test you and press buttons, and you'd be like, oh, what is this? And it's like coarse crackles, fine crackles, or friction rub, or so yeah, it was pretty cool. Some of them were like, what the hell? This person might have this, but
so we've got some really nice stuff.
Sometimes you gotta drive slow right here,
for a lot of highly recommended cars. Just checking out.
Niggas be driving crazy. Like, I can open up the garage here. But yeah, so I'm gonna show you everything when I get in the house. We just did assessments today. I got a 9 out of 10 again on my math quiz. I don't know what the hell is going on here, but I'm upset about it. But I mean, what can you do? I'm sorry, the camera's like going crazy right now. My mommy's not home. She's off today. I don't know where she could be. But yeah, I'm going to show myself online. Yep. And then I'm gonna stop park. But yeah, so I'm gonna show you guys the paperwork and stuff like that when I get in the house. The care plans and stuff. I think those are gonna probably be the death of me. Damn care plans. But yeah, I'm gonna show you that. We didn't do nothing else. Like I said, I got a 9 out of 10 on my damn. That's the heat. I got 9 out of 10 on my math quiz, which sucks, but hey, whatever. What are you gonna do? Before I take off my clothes and stuff, I'm gonna show you everything they got us. We had to bring this to school today, the nurse's pocket guide, because we were doing care plans and stuff. I don't know if you guys can see. I'm gonna turn my light on, my little lamp. But we were doing care plans. And then, or like practicing care plans. And then they gave us these 3. Now, this one was empty. This one was empty, but we filled it out, you know. Just a practice one because we have to submit it online. So they said that we could use this one just to practice, or we could reprint them out. It doesn't really matter. But then they gave us one that's like they filled out. Well, how can you speak English? That's the assessment, diagnosis, planning, implementation, evaluation. Sorry, my handwriting is like chicken scratch. But yeah, and then we have to do a 3-part nursing diagnosis or whatever. So the first part is scientific, related to a scientific part as evidenced by like your words, and these 2 have to be related. So an example that we did was constipation. Okay, right here. There's a lady, she read us a piece of paper about a lady basically, and we had to listen and we had to take subjective data, which was, she said her bowel movement, she hasn't had bowel movement for 3 to 4 days. What? Bowel movement. I think she said she hasn't had a bowel movement for 3 to 4 days, but when she did, I guess it was hard and painful. Now I'm not understanding, but anyways. And then we got her thing as constipation. The client's initials, her name was like Ella Brown or something, I don't know. It was fake. And then objective data was her respirations, her vital signs, everything else, her height, her weight, but I didn't get to write those down. But yeah, so we did her diagnoses as constipation, so that's scientific, related to eating habit changed, that's scientific, but we just did constipation related to eating habit change as evidenced by our own words. So widowed and decreased level of activity, decreased activity level, stuff like that. And then we did some, my back hurts. Let me put it right in front of me. Oh, my bed is like, my bed is so weird because it tilts right in the middle. There we go. There we go. Oh, perfect. Okay, so then we did some interventions. And for our actual care plan, when we get our real patients, we have to have 4. That's why I put that there so I can remember. Okay, so one intervention was determine fluid intake. I think that was one. And then the rationale was to compensate for dietary changes. I can't even read my own handwriting, y'all. And then another intervention, I put it backwards on accident. Another intervention was the contact the physician. And then the rationale behind that was so they could, because she's no bowing for like 5 days. I made that up. But so the physician could actually, you know, assess her labs and see what's really wrong with her. And then that's how the care plan went. And then we did, oh, this is their example of a care plan. Like I said, they just told us what to say and we wrote down pertinent details. So like subjective for this one is anything she said. So client say I fell down the steps, blah, blah, blah. And then objective is like age, vital signs, medication, stuff that the patient can't, you know, lie about. Okay, and then they gave us this, which is a data collection tool. So it's probably 8 pages. Yep, 8 pages. And we just answer questions. So we put our name, the hospital floor that we'll be working on, but we're going to a nursing home. So we'll put the nursing home name, the gender of our patient, the age. So we'll circle whichever one, the date of clinical, code status, allergies they have, and then we're just going to fill everything out. So admitting, date, and the reason for admission, events leading to the hospitalization or, you know, admission, past medical history. We got to do primary diagnoses and pathophysiology. So we have to actually cite sources of like the patho of whatever. And then ABC, so airway, bleeding, and what, something else, circulation or something. Therapeutic regimen, so what are you doing to treat that patient? Current health promotions, second diagnoses if they have one. And then this is like the fun stuff. So the diet they're on, the activity, the vital signs in the last 24 hours, all that stuff, blood pressure, respirations, pulse, temperature, the time you took it, the O2 sats, the trend. So are they hypoglycemic in the morning or hypoglycemic at night? You know, their pattern basically. Blood glucose before meals, bedtime, other, if they're diabetic, oxygen therapy. We have to, all the intake and stuff. And then down here we got the generic name and trade of their medication, the route, the frequency and all that stuff. Is it a high dosage or low dosage? Sorry, I'm moving. That's probably why the camera's moving. Let me move the camera up a little bit. Is it a high dosage or low dosage? The classification, the therapeutic use, so the action, any adverse reactions, we need to just write 1. Major side effect. Nursing implications, so what must you know before administering the medication? So like also life-threatening stuff. So this is like a, they're going to ask this, so we really have to know this before we, oh, hello, hi. We really have to know this before we, like get on the floor with the patient. Like, we can't get away with that. Then we also got more medications. Any PRN medications, the same thing that we're giving in the last 24 hours, that we'll be giving it when we're there. Medicate or procedures or treatments that need to be done, so like wound care, catheter, NG tube feeding, anything like that. Labs that were done this shift and the results. Basically, that's what this whole. Then we need the new orders in the last 24 hours. And since we're only going to be there for like basically 24 hours, like, you know what I'm trying to say, like we're not going to be there all day every day. We only need the last 24 hours since we've collected our paperwork about the patient, the new orders they received, discharge plans, client education, so teach back, like if they have an inhaler or if they have a spirometer, if they have something like that, how did we also teach them while assessing them, like, oh, you need to do this, you need to do this, and use that teach back. That's probably the most important thing in nursing, teach back. And then what is your plan care for the day? That's the Blue's Clues. I put that down because they're going to test us on that too. That's very important. So she said basically you can just put a chart because it's going to be online. So you can basically just put a chart in here and then write 6 a.m. I'm going to wake the patient up, get them dressed. 6:30, I'm going to give them their insulin. 7, I'm going to give them their medication. 8, I'm going to take them to breakfast. Like stuff like that. I mean, that's not the right order, but you know, stuff like that. What is your primary concern with her client today? And then this right here, she said we don't have to worry about like the assessment findings of this, but she said we're just gonna chart those, so we don't have to worry about that. But and that's it. So yeah, it was a fantastic day at clinical. It was a fantastic day at school. Next week's video is gonna be really short because it's just gonna consist of Tuesday and Wednesday, so you guys are probably gonna hate me, but yeah, sorry. But yeah, you guys probably like short videos. Let me know in the comments below if you like my long videos or my short videos, because I be feeling like I be cutting out so much because I'm like, these videos are too long and I don't think nobody's gonna sit through all like 30 minutes of this video. But let me know down below if you like short or long videos. You know, let me know. But because I do it for you guys, so I gotta get you guys input. But yeah, I'm done. I'm about to go eat, watch a movie, probably take a nap, chill. I deserve it. All this stuff. I told you guys I love this board. I don't do planners. I spent probably $60 on a damn planner. Like, the planner itself was $12. But to buy, I bought stickers. I'm going to show you guys this planner next week because the videos next week are going to be short. So I'm going to show you guys this planner that I freaking bought. And stupid. But I got this big old whiteboard. I want to get probably 2 more. Because I don't know if you guys know, but next semester I'll show you guys this next week as well because the video is going to be short. So next semester I'm taking 6 classes. So this could just probably be for my nursing classes. I'm going to get 1 more for my gens, and then I want 1 more for clinicals, you know, so 3. And we are moving, so I can put them anywhere I want. You feel me? So yep, I always put my week here. So this is week 13. I always put a saying about God because God is my everything. Without him, I kind of don't know where I would be, you know. This is the instructors, you know, their numbers and their phones, like texting and stuff like that. So I keep that up there just in case. And then I write what I have for the week. So and 121, so we didn't have nothing in 120. We usually have a quiz in 120, which is foundation in nursing, but we didn't have anything this week. So in 121, which is practical nursing, we had a mental health exam. That was yesterday. You see, I put my sad face because I failed, but that's okay. Put a check mark. I always put a red check mark when I did it. Blue is for important stuff. Black is just the classes. Red is important stuff too, that I did it, you know. We had a health assessment NCLEX question. I did that too. That's why there's a check there. And I got 100 on it. Kapowie. Nursing 122, which is clinical practice. We have a lab and we have lecture part. So in the lecture part, we had an NG, an enteral feeding, and med term quiz. Did that. That's why there's a check there. And then ATI, we had we had 3 modules for ATI. So we had nutrition, enteral feeding, and NG tube feeding or whatever. Did all 3, put 3 checks. Then we had 2 math quizzes. One Wednesday, put a check. I got to put a check for this week. I'm going to go get my pen, my marker, in a little compartment. And you guys witnessed this. Did my quiz. And if you guys don't have this, please invest in one because this thing is like the best thing ever. I got all my supplies in here. I'm going to clean it out when we move because it's hectic. I got markers. I got scissors. This is work. This is my work drawer. I got my tape measure, my badge. You guys know I work at Menards. That's me. I got my little handy notebook. Got my watch, my work watch. That's my school watch. But yeah, so I suggest you guys get this if you don't have it. So we had 2 math quizzes. Check that. Then extra, we had to do a foundations in nursing practice on ATI, and you had to get 90% or better to take the real proctored exam on week 15. So I put a sad face because I was like, ooh, I didn't want to do it. But I did check mark it and I got a 96.7 on it. So I'm happy. So basically, everything I had to do for this week is done. So, and then every week on Fridays, I print off my grades for the week just to see how they dropped and went up. And I have like 2 weeks ago or 3 weeks ago. Then I have last week's. And then I'm about to do this week's coming up. But yeah, everything is red checked. I did everything I needed to do. So I think I am going to have 1 for gens, 1 for nursing, and 1 for clinicals. Yeah, I'm going to invest in all 3. But yeah, that's the end of this vlog. I love you guys. Mwah. And I'll see you guys next week. Bye. T7, what are some of your favorite TV shows? Oh, I could talk about this forever. Let me get started. Let me start weekly, like weekdays. Okay, so Monday, do I have a TV show Monday? Love and Hip Hop Hollywood. That show is so good. And it just finished, so I'm upset. So it just finished, so Love and Hip Hop Hollywood. Scream Queens. I think that stopped for a while too.